Okay, well, good morning, everyone. Thank you for joining us online today. For those of you who don't know me, I'm Congressman Bill Foster. I'm a scientist and businessman, and I'm proud to represent the 11th Congressional District of Illinois in the U.S. House of Representatives. I'm glad you could join us for today's discussion as we talk about COVID-19 and the role that contact tracing plays in slowing the spread of the coronavirus. But first, I'd like to start by introducing our guests and thanking them for taking the time to be here with us to discuss this important topic. I'm glad to be joined by Heidi Clark from the Illinois Department of Public Health, Maria Cuevas, the DuPage County Health Department, and Ramesh Raskar from the MIT PathCheck Foundation. The past few months have been difficult for all of us. We mourn the loss of over 144,000 Americans, including over 7,500 people in Illinois. People across Illinois understand the need to slow the spread of the coronavirus and to flatten the curve. And while we did a good job flattening the curve initially, we're not out of the woods yet. As our economy begins to reopen, we must continue to wear masks and practice social distancing. Reopening safely will require following the recommendations of the scientists and public health experts. We've already seen the devastating outcome of prematurely opening as cases surge across the country, especially in states that did not act as swiftly as our own or opened in a thoughtless manner. We do not want to face the same fate here in Illinois, and that is why it's so important to listen to experts when discussing how to responsibly reopen. Following the guidelines from the state is the most important single thing that we can do right now to help our fellow citizens, and I urge you to continue to follow the recommendations of medical experts and public health officials. It's important to employ all the tools at our disposal to combat the spread of COVID-19, and that's why I'm excited for our conversation today. Contact tracing will play a major role in slowing the spread of COVID-19 and preventing any unnecessary suffering. I'm proud that the House Democrats passed critical legislation like the CARES Act, which became law, and the HEROES Act, which passed the House to provide even more vital assistance. The HEROES Act specifically provided $75 billion to support testing and contact tracing to monitor and suppress COVID-19. However, so far, the Republican-led Senate has refused to act on it. Reports have shown that the Trump administration has not even spent all of the money that Congress intended to go to enhance testing and tracing. Meanwhile, meaning that while the Republican-led Senate refuses to act, money that should have been allocated to preventing the spread of COVID-19 is elsewhere. It's exposing more Americans to this virus and delaying our ability to adequately and safely respond. The Trump administration and Republicans in Congress have mostly taken an approach of denial of the facts. It's an approach that puts more and more Americans at risk and will do more damage to our economy in the long run. Our guiding principle must be that the health and well-being of our people comes first, and that's why taking advice from medical professionals and public health experts must take precedence. I'm glad that we're able to be joined by experts in the field for today's discussion on contact tracing. We're all in this together. I look forward to today's discussion to answer your questions. And so I'd now like to turn it over to my colleague, Sean Casten.
Thank you so much, Congressman Foster, for doing this. I hope we get to do more of these science-led events, especially in this moment. Our success depends on elevating the views of people who have legitimate expertise and are legitimate scientists on these issues. I'm really looking forward to the conversation. I'm really looking forward to the expertise, and want to just share sort of, at least how I think about this stuff. And for other people to be thinking about, contact tracing is not new. It's not unique to COVID. Contact tracing is a critical public health measure that is something we have to do, especially for communicable diseases where there's no vaccines and therapeutics available, or where they are available but not widely available. And for contact tracing to work, it really has to do three things. There has to be trust. People have to trust that the person or the app they're giving their information to, that they're comfortable providing that. We have to be able to take action. In the context of COVID, that means quarantine, isolation. In the context of other diseases, in the context of AIDS, where we didn't have vaccines for a long time. How do we make sure that we get, appropriate safe sex needle exchange programs out there, different diseases, different modes of communicability. So trust, we have to be able to take action, and the response has to be timely. If we can't respond until the individual has already spread the disease to 10 other people, we haven't really worked. And an awful lot of times that's meant preventative action. So if we can't get to you to test you and stop you from spreading quick enough, then it's really helpful if everybody wears masks, because then even if you're not infected, we'll make sure that we get timely preventative measures in place earlier. I mention that because contact tracing has to do all those three things to work, but contact tracing alone can't do all those three things. Contact tracing can't make you wear a mask. Contact tracing can't make you trust somebody. And that's true whether it's a digital or an analog solution. If I don't trust you as someone knocking at my door to keep the information private, I have the same questions if it's an app that's keeping track of where you are. And I'm really looking forward to how our guests think about how to do those and how we can better do those with a whole of government response. Because everything that I just described, the virus doesn't know where state borders are, the virus doesn't know where national borders are. But ultimately, if we had an analog solution, we would never say, let's track information in Illinois and not share it with Wisconsin, and Wisconsin shouldn't share it with Minnesota, and the United States shouldn't share it with Canada, because the virus doesn't know where those borders are. And the same has to happen as we get to digital solutions. So I look forward to the conversation, welcome the education, and with that, let me turn it over to people who know vastly more about this than I do, and specifically to Heidi Clark, who is the Chief in the Division of Infectious Diseases at the Illinois Department of Public Health. Heidi, the floor is yours. I look forward to the education.
Thank you so much. I will share my screen. So I'd like to start by giving an overview of what COVID-19 looks like in Illinois. So from the time we got the first case until yesterday, this is a map of the cases and the deaths by county in Illinois. As you can see, there have been COVID cases in all 102 counties in the state, and the orange circles represent the number of deaths. So deaths have been spread across the state, the disease has been spread across the state. It doesn't respect any type of state line, county line. And while there's different issues that affect every community and make contact tracing a challenge in each community, it's something that exists everywhere, and why we are investing in a statewide solution to enhance the local health department and other efforts towards contact tracing. So, as was mentioned earlier, it's important to focus first on COVID-19 prevention. So this includes all of the things on the screen, but really we're focusing on the 3 W's: wear a mask, watch your distance, and wash your hands. However, even while utilizing all of those safe practices, there inevitably will be people who end up sick. So on this slide, it shows the COVID-19 response cascade, starting with testing, which identifies people who test positive for the virus. The local health department or other contact tracer investigates that case, elicits contacts from that case, and then ensures that each case has the option to isolate and quarantine safely. So as was mentioned again before, contact tracing is not new. It's been used for measles, Ebola, tuberculosis, STDs. This is the biggest test of our contact tracing that we've seen in the history of public health. So contact tracing involves trained public health staff working with people diagnosed with COVID-19 to help them recall everyone who they've had close contact with while they were infectious, public health staff then alert those contacts as quickly as possible to prevent additional spread of the disease. An essential part of contact tracing is care resource coordination, and that's enabling cases and contacts to safely isolate and quarantine at home. Identifying the individuals is just step one. There needs to be a focus on making sure that once they're identified, they can be separated from people that they may be in danger of infecting. However, there's challenges there. People are afraid to miss work. They may need medicine from the pharmacy or groceries, or they might have an unsafe home environment. And that is something that as a contact tracing program, we need to focus on care resource coordination as well. In low resource areas, it's especially important for the public health system to support safe isolation and quarantine. So the state of Illinois is doing a lot around contact tracing, but really the local health departments have been the backbone of the COVID-19 response. There are boots on the ground, and they have been one of our success stories in the state, and why we are seeing lower numbers than other states is due to the really hard work of the IDPH communicable disease section, IDPH as a whole, governor's office for supporting true public health efforts, but ultimately it's the local health departments that have been doing the work on the ground. IDPH is supporting the local health departments through grants to all 97 certified local health departments that cover the vast majority of the state. We're utilizing software to support local health department efforts. There will be a speaker later who's going to talk about some more technology. This particular software that we're using at the state is not something that the cases and contacts will ever see, but it's something that the local health departments utilize to make sure that they are getting all of the information that they need and that they're able to share that with surrounding jurisdictions. And then we're working with partners to help educate about COVID-19 and contact tracing. And then I just wanted to highlight one notice of funding opportunity that was released yesterday. $60 million has been made available statewide to 9 of the 11 COVID regions. Cook County, including the city of Chicago, is not included in this because they are already allocating funds towards community-based organizations. In this, the regional coordinators will provide direct services and subgrant to community-based organizations. And there's a specific focus on hard-to-reach populations and communities that are disproportionately affected by COVID-19. The community-based organizations will conduct contact tracing in collaboration with the local health departments. They'll be providing education and outreach to historically marginalized communities and provide care resource coordination, focusing on those communities that most need it. And with that, I'd like to pass it over to Maria from DuPage County Health Department to talk more about the incredible work that they're doing at the local level.
Thank you, Heidi. And I'll go ahead and share my screen with everyone. Thank you. So my name is Maria Cuevas. I am the project director for our case investigation and contact tracing program with the DuPage County Health Department. I work closely with our communicable disease staff, our medical director, epidemiologist, and disease specialist to kind of address the most important needs for the community as we launch our case investigation and contact tracing programs. So here's a little bit of an overview of what DuPage County has started to do. So since early May, we restructured some of the available staff within our health department to be able to conduct these case investigations and contact tracing. Currently, we're recruiting for an additional 108 positions. Internally, we have about 61 staff that are conducting investigations and contact tracing. We have taken direction from IDPH and the CDC to kind of implement our programs across the agency. As Heidi touched on earlier, the work really starts with case investigations. So we, through our system in Illinois, INEDS, we receive all positive cases that have been tested at any facility and for any DuPage County residents. So from that point, those cases are assigned to our case investigators, who will make attempts to try to reach individuals who have tested positive. During the process, they will educate individuals on what the best practices are as far as isolating at home, keeping away from others, making sure that they educate any household contacts or even close contacts if they have that relationship, to let them know you may have been exposed. These are the next steps. When we talk to an individual, we will ask them about where they were tested, what are the symptoms that they're having, how are they feeling, and what resources do they need to safely isolate. As Heidi expressed, we do have, DuPage County has an extensive list of resources and partnerships with organizations where we can wrap around services. We have seen an increase of financial assistance with individuals who are being laid off due to COVID-19. So we want to make sure that we obtain and are able to provide resources and linkage to services so that they're able to isolate. We also inquire about their close contacts, and that's really where our contact tracing efforts begin. So contact tracing is reaching out to anybody who has been in contact with someone who tested positive. They're identified as meeting with that individual for at least 15 minutes or more within 6 feet. And so we really try to, once we identify those individuals, we try to call them as soon as we can to advise them what they should be doing. This includes quarantining for at least 14 days from their exposure, making sure that they monitor their symptoms, making sure that they stay away from others, that they practice, cleaning and disinfecting any high touch areas within their home, and really staying home only leaving to seek medical attention. We also encourage anybody who is a close contact to get tested if they notice any symptoms. And even if they don't, a lot of individuals who are testing positive for COVID-19 often don't show symptoms. So the best way is to make sure that they get tested. And I'll go over some of the resources in a little bit. This is just a brief overview of what our case investigation and contact tracing looks like. So again, we have trained individuals that will reach out to anybody who tested positive. From there, we'll reach out to their close contacts and educate them on what they need to do to make sure that they don't spread the disease unknowingly. And then we'll provide education and resources. If at any point the close contact tests positive for COVID-19, we will then go ahead and start a case investigation with that individual and work with them to identify their close contacts as well. And then the process starts all over. One of the things and one of the barriers that we're seeing within the community is that they're skeptical to answer our phone calls. So we do want to send the message that we will never ask for your bank information. We will never ask for your social security information, and we will never ask about your immigration status. If you identify that any caller is saying that they're a case investigator or contact tracer and they begin to ask these questions, you can certainly hang up, but please know that the health department staff will never ask you for these questions. We will ask you questions about where you got tested, what symptoms you're having. We'll ask you to confirm your date of birth and address to make sure that we're speaking with the right individual. And then we will ask you about your close contacts. The more information that you can provide about your close contacts, the better success we will have to educate those individuals so they can mitigate the spread of COVID within the community. So please, whenever you receive a voicemail, a call from the DuPage County Health Department, make sure that you answer the call. This is helpful in mitigating the spread within DuPage County and across borders. As part of our resources, the DuPage County has set up a testing site that, that's available in our complex. We have been seeing more and more that we're meeting our 400 test capacity earlier and earlier during the day. There's times by like 9 o'clock in the morning that we're completely done with our testing because we've hit capacity. But we encourage you to seek medical assistance or testing through our facility if it's available, if you're able to. The testing for DuPage County is free, and there's no criteria to get tested. We encourage individuals to do so. We also have resources that link to IDPH, and they have a list of community based testing sites that are available for all Illinois residents. The other way to get tested is calling ahead to your primary care provider so they can tell you where to get tested. Different hospital systems and practices have different criteria, but there's always an option and resources available. So please make sure that if you are not feeling well, touching base with your primary care doctor or seeking to get tested. And then again, Heidi touched on this. Remember to watch your distance, wear a face covering, wash your hands, and always answer the call. It's really important that you guys take those steps to help your local health department in mitigating the spread of COVID-19 within your community. With that, I'll hand it over to Ramesh. He is an assistant professor with MIT.
Thank you, Maria. I need to share my screen, I guess. Fantastic. Great to be here. Thank you, Congressman. I'm Ramesh Raskar, Associate Professor at MIT Media Lab, and also founder of PathCheck Foundation, where we are helping states with exposure notification and case management apps for citizens so that we can restore the issues in public health, as well as back to work solutions. So as we heard from Heidi and Maria, exposure notification and case management, if you had to use smartphones for this, it's using Bluetooth for proximity, then get an exposure notification if you have cross path, and really achieve this while maintaining privacy and speed of that notification. And number three, which is only partially solved so far, is how does this exposure notification actually help public health and businesses with coordination tools? And the question I really want to kind of frame this conversation is, can we create the equivalent of a national weather service for pandemics, where we have a bird's eye view of everything that's going on as we see in, say for a hurricane, and also have prior models of that hurricane? Can we do something similar using smartphone-based solutions? So what we're doing at MIT and at PathCheck Foundation is creating boot camps for US states to overcome 4 main challenges the states are running into to launch these Bluetooth-based apps. Privacy perception. For that, we have a group of ethicists, stakeholders, and technology algorithms. Adoption strategies. How do we get 50–60% of adoption? Messaging, incentive programs. What about the cost to deploy and develop such technology, because there's sufficient complexity, which could vary anywhere between $1 million to $10 million per state, but can be dramatically reduced with open source and a nonprofit model. And how does it connect to public health? How does it reduce the load on manual contact tracing? How does it improve case management? And any digital transformation of any solution has problems. Despite its promise and efficiency and cost, you'll always have issues of inclusivity and empathy and so on. So how do we overcome those? And so what we're doing at MIT and PathCheck is really providing a neutral venue to advise states, share best practices, provide resources, and provide these boot camps so they can actually deploy these apps. And so PathCheck Foundation is for exposure notification as well as case management. Fortunately, we have contracts with multiple US states, territories, and nations. So it's not just a think tank, but we have a full-fledged team that going and deploying these apps and servers and dashboards. It's also the world's largest open source nonprofit project for COVID-19 digital solutions. The team is made up of 50 full-time volunteers. And we also have long-term philanthropic funding to have 20 full-time software engineers in addition to epidemiologists, privacy experts, and behavioral scientists. And we're very proud of the team that has come together, some of the top CEOs and CTOs and leaders who are just taking a break and saying this is a very important mission and working with us full-time now. And so in that sense, the PathCheck platform has the PathCheck app shown on the left, and also the dashboard for public health and businesses. And our primary emphasis is to deploy the Apple, Google-based Bluetooth solutions, but we also have everything else in our code base, based on GPS, based on Wi-Fi, based on QR codes, and so on. And in that sense, we're agnostic to the underlying technology. And so we provide software, we provide insights, and most importantly, we are partners. We go step in step in some of the states actually that are neighboring states for Illinois. And when you think about the individual's experience, as Maria said, it's not just about the exposure notification, but it's about triaging, testing, providing them benefits for food and medicine, quarantine, and what happens when they exit. So the individual's experience is pretty complex. And can we provide a digital solution that goes through this? Of course, some software company can come and just deploy a solution like this. The challenge for all of us is how do you do this in a privacy preserving way so that we don't have unintended consequences for this. And this is where our teams come in and make sure at every stage of this operation, those values are preserved. So there's often question about, should you do manual contact tracing? Should you do digital? And of course, the solution is, let's have best of both. If you think about what Heidi was talking about, contact tracing, triaging, and monitoring and support, on the left side, you have these 3 steps in the case management: identify contacts, interview them from context, and decide whether you should set, test, isolate, and provide them daily support. On the digital side, there's only part of the thing you can do because you rely on the individual to be technology savvy and sufficiently motivated to go through this operation. So for contact tracing, they could get exposure notification, but they themselves had to go and decide whether they should self-assess and do symptom checking for triaging, and also self-monitor and ask for help. And so what we have done at PathCheck is really try to bring these 2 solutions together that maintains privacy, but also achieves scalability. I mean, if we have 50,000 cases across the nation per year, it's really stretching the manual contact tracing system. At the same time, if you have very specific outbreaks in nursing homes or meatpacking districts and so on, obviously manual contact tracing is the right solution in that places. But if you have colleges and restaurants and office goers, maybe they can use the digital solution. So we can weave through these paths and sometimes use digital, sometimes use manual, and the blue dots and arrows in the middle show that we can use actually a hybrid solution. So what are parameters of a good smartphone solution? First of all, it should be built by a nonprofit because it will avoid the misuse of data. Any metadata such as IP address, which is always leaked, does not get misused, is privacy preserving and hack proof. It should be open source so that the residents of the state can trust. It doesn't have a vendor lock. The learnings can be shared with neighboring states. And of course, it should be interoperable across state boundaries. You don't want a for-profit organization that starts building walls between states so that they can have this captive audience. We should insist that they're treated like public utilities. And then the discussion today is about, it should be useful just beyond exposure notification. It should absolutely connect to public health and manual contact tracing. And health is a very regional topic. The culture, the mechanisms, the implementations are very regional. And ideally, an app-based solution should reduce the cost of manual contact tracing if college students, office-going employees, people who go to restaurants can be treated, can be managed with an app-based solution. Hopefully, at least 50% of the cost of manual contact tracing can be reduced. It should support various languages. And our estimates show that the cost of running an app is about 10 cents per person per year. So for a state of Illinois, it'll be about $1.2 million. So ideally, every state should just have the solution deployed, not just during the current pandemic, but as for preparedness. So it's just a delight to be here representing MIT and PathCheck Foundation. And I'll hand it over to Congressman Casten for Q&A.
Thank you. And Sean is muted. And so in the absence of an audible Sean, maybe I'll ask the first question.
Go ahead, Bill.
So I guess this one is probably best for Maria. Should businesses, what about businesses? Should businesses be encouraged to participate in digital contract tracing when they are reopening their offices and bringing back workers? And what about schools and universities? What is today's best advice on that? And you'll have to unmute, Maria.
Certainly, if the technology is available, we would encourage for businesses, universities, schools to engage in this type of contact tracing. It just allows the notification to happen much more rapidly than like the human factor, just because we're limited by hours of operation. So we would encourage businesses to engage in these type of services. We have already been working with businesses, schools, superintendents in DuPage County to provide, what the best practices should be as, they reopen their workforce, they reopen schools. We're providing symptom checkers and, monitoring logs so that they have the best kind of education for their employees and for their staff. So we want to make sure that, if there is technology available that allows us to get notifications out a lot sooner, that they engage.
Yeah, thank you. And are there situations where the businesses are forcing employees to install digital contract tracing things that might not be okay with the workers from a privacy point of view?
We are not aware of anyone using those type of applications at this time. We don't know what that looks like across the board in Illinois just yet. But certainly there might be questions about privacy for individuals that come up later if there is some sort of implementation across the board.
Thank you.
The question for Heidi or Maria, but since Maria answered the last one, maybe I'll throw this to Heidi. Do you have any concerns about false positives or false negatives when you go through this contract tracing process?
Yes.
Do you have worries about notifying people of the wrong information?
I think our biggest concern from a public health perspective is the false negatives. We do know that they occur, and it's often related to the quality of the specimen collection. So a false negative can give an individual the impression that it's safe to be around other people, and they may be ignoring the public health advice, especially the 3 W's I mentioned earlier. So those again are wash your hands, watch your distance, and wear a mask. So an increase in, or just any false negatives would increase the number of contacts that an individual would be likely to have and increase the potential for transmission. So that is a concern.
Okay, let's see. The next question here is, I guess, about the CDC. And hasn't the CDC issued guidance on how to use contact tracing? Or do public health departments and businesses and everything actually need more and better guidance from the CDC?
So they have issued guidance. It's available on the CDC website, and IDPH is working with local health departments to standardize what needs to be standardized, but allowing for variations that make sense for local jurisdictions. So again, the guidance is out there, and the local health departments would be following up on cases. But if businesses and workers want more information, it is available on the CDC and IDPH websites, or they can work through their local health department. And maybe Maria, you have some more to say about what the local.
Yeah, so yeah, definitely the CDC has provided guidance as how do we implement our contact tracing programs. So that has been helpful, especially because we need to scale up as quick as possible to be able to be effective in the process. The health department and our directors are consistently meeting with superintendents as we get closer to reopening and the school year. They're meeting with superintendents, they're meeting with businesses, they're meeting with different municipalities in our hospital systems to be able to address any gaps so that we're able to successfully implement our contact tracing program. We're able to, to communicate the best information and the best guidelines for businesses and schools as they reopen.
Well, I have a question, and goes to my, I mentioned at the start how any of these systems are sort of depend on trust. If you're going to send somebody to somebody's house and say, tell me who you've been with over the last few weeks, and by the way, the consequences of this is that you might have to stay home in quarantine, that person better be trusted. How are you recruiting and training the people to do the contact tracing? And how many do you need? Where do you have gaps? How are you thinking about that?
So right now, we are recruiting for 108 positions. Initially, what we did is we utilized existing and internal DuPage County staff to be able to train them. We provided them with scripts and kind of best practices as they're conducting these investigations. The process has evolved as more trainings have become available. So we do have trainings that are required by IDPH as we onboard contact tracers, which include like an ASTHO training. We're also asking individuals to complete the Johns Hopkins contact tracing program that they put together. And then we're also educating individuals on the proper isolation and quarantine guidelines that IDPH has set forth and updating them as quickly as they're updated so that they make sure that when they're speaking to individuals, they have the most up-to-date information. And we're also training them on motivational interviewing skills, how they can work to build rapport during the interview with the person that they're in contact with. And part of that training also includes cultural competency. We're working with individuals from very different communities. We're trying to onboard individuals that have different backgrounds so that they're able to connect with the cases and close contacts as much as they can. We're humans before anything else, so kind of being able to build that relationship, making sure that they understand that we empathize. For some individuals, this is a very hard process. So we're often providing resources. We're making sure that that our staff know what resources are available in DuPage County so that we can make the linkage, whether it's behavioral health services, whether they need to apply for insurance, they need food delivery, do they need assistance with their medication? So actively listening and kind of encompassing all that in one training. It's about a 2-week process for an individual to train. And then we also have to train on any software that we're using. So kind of incorporating all that into the training. There's also different schools that are putting curriculums together for a contact tracing like certification. So kind of working with the different schools in the area to make sure that, we're able to provide updated guidance on any information that's needed.
Okay, and I have a question that's sort of a follow-on from that. Are there penalties for lying to a contact tracer, or if you test positive and you say, well, that's tough, I'm going to go to work anyway? Are there actually legal penalties for either of those, or does it depend on the good faith of everyone involved?
So we're counting on good faith. We are wanting every individual to follow the guidelines. There are some consequences where we can issue a quarantine or isolation order for DuPage County residents. So we want to make sure that they're following the guidelines. We're wanting that they, you know, work with their employer to report if they've tested positive, making sure that they're working with their human resource department to address, you know, okay, I need to stay home. This is what I've been, you know, educated to do. How can we make this work? But there are some steps that local health departments can take to help, you know, for residents to comply with what we're asking.
Okay. Sean, do you have a question?
Yeah, so let me pivot to Ramesh. I'm curious. I really appreciate what you said, and it's your commitment to being open source and making sure that everybody has access to this is laudable. And yet, not everybody is laudable. So, does digital contact tracing work? Can it work if, notwithstanding your best efforts, we end up with a patchwork of apps from different localities, different states, for-profits, nonprofits, different APIs? Can it still work?
Yeah, thank you, Congressman. I mean, you know, this is a very new world we live in. I think the epidemic, the pandemic is unprecedented, but so is the use of technology. I mean, who would have thought that we can, you know, get a taxi and sit in a stranger's car and go somewhere in Uber, or, you know, order food and it'll be here. So we live in a very unique times, and we have to see if we can use those technologies in the right way. So if we start using digital strategies to, you know, age-old problems like epidemics, definitely we have a window of opportunity to see how they can be used. So there's a lot of faith. If you look at the European countries, about 20% of the population downloaded an app in the very first week of its release. So that shows a lot of promise. And if we can reduce the cost of tracing by 20%, let's at least start with that. Maybe it'll be 50%, 60%, and so on. Your second question about the patchwork of apps, especially if they're cross-border incompatibilities, again goes back to being open source and nonprofit, because if you insist that you cannot treat our state like a captive audience and you must work across these boundaries, in fact, you use similar code base and similar principles, then hopefully these things will not come in place. I mean, the mess we have right now in electronic medical records, electronic health records, where if you go from one hospital to another, you can't get your data. We don't want the same mess in this pandemic. So I think going open source nonprofit from day one would be the right way to go. And the technological solutions exist. It's just that the motivation for the app maker should be to actually be a social good, as opposed to some kind of a profit motive. And if you're down to 10 cents per resident per year, clearly this should not be a money-making opportunity for an app maker. It should be really for solving the societal problem.
Yeah, and I guess I appreciate that it should be that way. I'm more asking, it drives me crazy that I can't get music off iTunes and get it to another venue, but that's sort of a trivial, and that maybe only applies to old farts like me who loaded all my music from a CD instead of just downloading it from some website. But if we end up with multiple platforms and we fail to have a common standard, can that still work?
I think it's perfectly fine to have multiple apps, even different app for different state. In fact, even at PathCheck, we white label. We effectively donate all our stuff to the state, and the state will customize and launch it. We, of course, do the hand holding. So the analogy with National Weather Service is the same one. I mean, you can use any app you want to learn about the weather, but National Weather Service has a bird's eye view, and everybody can download the data from National Weather Service. So in that sense, it's compatible. And I think the same thing we need for national coordination. The solutions can be built by players as long as they adhere to general standards. And we're trying our best to make sure those standards are clean and good for everyone.
Okay, so I guess the next question is, just how many people have to use these contact tracing apps for them to be effective? Does everyone have to enter a bunch of data into it every day? Or are these things that people just load them and forget about them until they warn them that they've been exposed?
Yeah, I think in terms of you want to minimize the user interaction. So it should be something you download, you leave it in and you know, leave your phone in your pocket or just go around your daily life. And at some point you get exposure notification. And after that, the process that Heidi and Maria talked about also takes you through a case management, so that all the questions you would ask, are you at risk? Can you live by yourself? Can you go get tested? All those questions can be asked on the app. And so that reduces the load on manual tracing. We work in certain countries where they have no manual contact tracing at all, zero infrastructure. And in those countries, of course, you want 60, 70% of the population to actually have the app. But in a state like Illinois, which has a fantastic, you know, public health, solutions that we heard, a 10%, 20%, 30% adoption will already make a huge difference, especially if it's a clustered community like college students or, you know, people going to a bar or going to restaurants or working in a facility. If they start using it, we'll get a lot of benefits right away.
Yeah, there's also a benefit for not going to bars until we get rid of this, but that's a separate discussion.
Yeah, I mean, at some point we had to restart the economy, and the solutions like exposure notification and even testing are effectively early warning system, because individuals want to know, should they take care of themselves, you know, drink more fluid, rest, and should they also take care of their loved ones? So exposure notification and testing is really kind of an early warning system. If we have that, enough parts of the economy can go back to normal.
Ramesh, how do you think about, I mean, here we are in this Zoom call because all of us are following the 3 Ws. And, you know, we're having these rather large debates, at least on a dollar basis, about how to get national broadband to the country, because so many of the people who were really adversely affected by COVID didn't have access to the internet, didn't have broadband, didn't have access to technology. Using a voluntary app that depends on owning a cell phone and being digitally savvy, I presume that's going to have a harder time reaching into some of the communities that are most affected, the elderly, the working poor. Where do you see the limitations of voluntary app-based, and are there things we need to do beyond just a voluntary app to make sure that we really hit the affected communities?
That's a very good question, Congressman. And in fact, as Maria said, the empathy, the trust, meaning that these tracers get is a very important component of it. And the software is not going to replace that empathy. At the same time, you know, we have 18 in state of Illinois, between the ages of 18 and 64, 90% of the population has a smartphone, including, you know, teens and elderly people. So that's a useful statistic to remember. If 90% of the population can be incentivized to, you know, solve the problem, for the remaining 10%, of course, we should continue to use. Inclusivity is very close to my heart, and I think we should continue to use the solutions that really work and are effective already in that population. Elderly, as I said, people who cannot afford a smartphone, or people who just don't trust technology for some reason. So we should continue to do that. But for the remaining 80 to 90% of the population, we can dramatically reduce the cost and improve the efficiency. And, you know, maybe it's a slightly different topic, but if you want to reduce the digital divide, maybe we should just give away $100 smartphones to the 10% of the population. It'll help not only for the epidemic, but there are also 2 additional benefits. You know, you can have a communication channel with the population. So the state can send broadcasts that are geared towards every zip code or every community and so on. And it can also be for self-assessment. So you can have a statewide dashboard that shows, you know, if people are doing self-assessment, they can self-declare saying, hey, I'm at risk, I have to self-assess on every day. And you can have an incentive for them. Maybe their insurance premiums get reduced, or they get sick leave approved in a faster way, or they get ahead of the queue for testing and things like that. So creating those incentive models could get close to 100% of the population and also reduce the digital divide.
Okay, the next question is, I've heard that some governments and businesses are giving employees little bracelets or watches or badges that alert them when they get too close to someone. Is that a viable approach to all this that doesn't rely on cell phone apps? And who's doing this, and is it going to work?
Yeah, so actually the PathCheck platform is being used in certain workplaces as well. where they have custom solutions, either using Bluetooth beacons or wearables and things like that. And we have many partnerships. And of course, they, as you can imagine, Congressman, they're good for those certain, settings. Let's say closed environment settings. But the moment that individual goes outside that workplace, clearly that solution doesn't work. And often the reasons why they use bracelets and special devices because they're not allowed to carry their cell phones and so on. So I think for the general population, I think smartphone-based solution is certainly the best thing you can do. But for certain employers, you would need that. I think some people have talked about giving bracelets to school-going children, which sounds interesting in the beginning. But this bracelets also cost roughly the same as an old smartphone. So it's better to create a campaign to ask residents to donate their smartphones. Every one of us have a bunch of smartphones sitting in our drawers. We should just donate those smartphones and distribute them to people who don't have them, or even school kids can carry it in their bag, not making for a phone call, but just for exposure notification. Because you don't need an internet plan and you don't need a SIM card to get exposure notification.
I may need you to come into my daughter's schools and enforce the not making a phone call from the smartphone in your bag.
Just in the backpack, don't take it out.
All right, wrap it up.
What? No, we're being instructed to wrap it up. Okay, well, just one more just general question. How do you really convince a person that isn't too tech savvy that all this information is really going to stay private and it's not going to be scooped up by Google or Facebook or Apple and sold to someone?
That's a very good question. Unfortunately, the track record for the technology players has been very poor despite those promises. The good news is that the Google Apple exposure notification protocol is sufficiently secure, and a lot of the work we have done and others have done in addition to that is extremely private. And in fact, I'm hopeful that this pandemic, this crisis will actually kind of give us back our personal freedom. The same way the green padlock on a website gives us the confidence that we can enter our credit card information, it'll be secure. We need a similar green padlock on our apps, so we know that nobody else is looking at that information, and create a computational guarantee, not just based on regulations and legal guarantees, promises by tech companies, but a computational guarantee that none of this data is getting misused. I think for exposure notification, we do have that in place. So I think that's the good news. But again, if a for-profit company is running that exposure notification app, they can always correlate the data with the other for-profit and other for-profit purposes and misuse it. So as long as it's open source, non-profit, and auditable, I think we should be in good hands.
Yeah. Now, does Apple and Google publish the source code for the part of the contact tracing that happens in their operating system, or not?
So Apple and Google are only providing the APIs, the tools to build these apps. The apps are going to be built by startups, companies, and nonprofits. And so it's really up to the state to decide who they want to work with. I think the best combination we have seen is let the nonprofit deliver the app and have a for-profit enterprise software company deal with the server. That's a combination of a nonprofit that is using the solutions that's used by a citizen or resident, and a for-profit for the backend is a good combination there.
Okay. And is there a third party that comes in and audits this, so that you actually know that you're doing what you say?
Yeah, I think that's an open question. I think open source shines some light on it. So that's one way to do it. And maybe in the short term, till we get the regulations in place, maybe insisting that it's open source or nonprofit is the easiest way to go.
Okay. Well, good luck with it. I mean, it's a wonderful thing, and it's going to make a lot of difference when this gets working and widely adopted, and and using that in combination with the tried and true manual tracking and tracing testing and tracking is really the those are the tools we have. And I just want to thank everyone here. Sean, do you have some closing comments?
So I think I'm going to close with number one, thank you so much to all of you for being here. Thank you, Congressman Foster, for setting this up. And I just want to stress for everybody who's watching this that someday we will have vaccines, someday we will have all these apps. And in the meantime, wash your hands, wear a mask, socially distance, stay safe, because we've seen a lot of other countries have taken those really simple, really basic techniques and gotten down to, you know, very low levels of infection. And we have the capability to do that here as well. And don't lose sight of that simple stuff that even a caveman could do who didn't have access to a smartphone and vaccine technology. And in the meantime, thank you all for working on those more cutting edge solutions.
Okay, thank you all.
Thanks all.